Running has many health benefits, but over 14 million people are injured every year, and a lot of those injuries are because of improper technique. Over 24 people gathered at the Leventhal Sidman Jewish Community Center in Newton to hear the co-medical director of the Boston Marathon, Dr. Pierre D'Hemecourt, give injury prevention tips for running.
Runners are commonly injured, and in fact the injury rates have stayed quite high for the past 20 to 30 years. And so people get frustrated with that and then they stop running. And I think it's really important to try to keep people in the running mode, and so injury prevention is certainly one way to do it.
With the Boston Marathon less than a month away, people are finishing up their training regimen and hoping to stay healthy for the big race. Dr. D'Hemecourt stressed that impact peak was a key reason whether a runner can hurt themselves or not. Factors that contribute to impact peak are how your foot lands on the surface, overstriding your legs, cadence, posture, and running with a stiff lower leg. In order to prevent injuries, D'Hemecourt advised to not lean at the hips and to run by raising your trailing leg quickly and vertically by flexing both your knee and hips. This will achieve a flat-footed landing, no overstriding, and good posture.
What we think is really the important part of running is how your foot is hitting the ground and how much of an impact force that you have.
Although these adjustments sound easy to make, they require humans to relearn their neuromuscular system, a task that takes time. D'Hemecourt asked Boston Marathon runners to not alter their running technique until after the marathon.
Way too late to try to train for this marathon now. Think about things like hydration, hypothermia. Think about making sure that you take care of your injuries.
D'Hemecourt himself also felt strongly about a couple of myths that don't really help runners and can actually hurt them too.
That drinking lots of fluids will decrease your risk of hyperthermia. That's probably one of the biggest pet peeves that I have, because people need to learn how to hydrate appropriately, which usually means that you need to weigh yourself before and after a long run, stripped down, to see that you're indeed losing about 1 to 2% of your body weight. You don't want to be gaining weight. That's really an important factor.
Medical research has made people smarter about injury prevention when it comes to running. And although it may be difficult for a runner to change the way he or she runs, there's no doubt that making that change will help reduce injuries. For Newton News, this is Andre Kachatourian.